have we covered that one that I emailed you about the estrogen is the cause of losing hair loss?
Not to my knowledge, so that would be a good starting
Okay.
place.
I've been getting a lot of emails about it, even though it's like only like a day old or something. And it's so far it's one of the most read articles I've posted
Oh
there.
wow.
Uh, so basically, what and it really destroy it doesn't destroy, but it's like it damages the follicle and it's behind the fibrosis that forms in advanced stages of hair loss, right? The scalp actually shows clear signs of fibrosis, and it's the estrogen that's really doing it. And actually they tested several different estrogens, and all of them, even ones that mainstream medicine claims are inactive, such as alpha estradiol. Now, the typical one is 17 beta estradiol, but alpha estradiol, which is considered inactive, also cause baldness, right? Androgens did not, right? And then things that opposed estrogen at the receptor level, that study used the drug fulvestrant, which is, I don't recommend it. Yes, it is an estrogen receptor antagonist, but it's actually just a synthetic estrogen, which if you look at the molecule, it is estradiol with a slight modification on position 7, and basically that's what endows it with the ability to be slightly less estrogenic. So to me, it's a SERM, right? It's not a direct estrogen antagonist. It's more similar in effects to drugs like tamoxifen and clomiphene and raloxifene. They're all synthetic estrogens, and they're anti-estrogenic in some tissues and then pro-estrogenic in others. Fulvestrant is probably the least estrogenic of them all, but it still has that effect. Long story short, it's the antagonism to the estrogenic receptor in the scalp, in the follicles, that allowed the researchers to completely restore hair growth in the mice. And I did some reading, and basically progesterone, which people at this point know is the endogenous antagonist on the estrogen receptor, the most potent one, can probably fill in for fulvestrant without many, if not most, of the side effects. It doesn't have the estrogenic potential of fulvestrant. And there's some dosages that are mentioned in the study, and they're really low. And the best thing of all, they managed to completely restore hair growth by only twice weekly application. So if you look at the post, I state basically for a human, it would mean to treat the condition, it would mean applying 1 milligram of estrogen dissolved in something like acetone. They used acetone, but I think ethanol is at least as good, if not better. And then the dosage was 1 milligram of an estrogen receptor antagonist, let's say progesterone, per 10 square centimeters of bald area, which is really not that high of a dosage. Like if you have raised Progest E, I mean, you can basically rub 2 drops on your scalp if you're completely bald, and you should be okay. And the best thing of all is that the treatment was only twice a week. And after about 8 to 10 weeks, if you look at the graphs, the mice had basically the hair growth was restored to control levels, to the control group. So I mean, I'll be trying it. Let's see if other people try it. Let's see how it plays out. But I think that's kind of throws like one of just yet another myth dies, and I know the myths die hard. But if you look at the study and the explanation, it says basically whoever started this whole thing about the androgens being the cause is probably one of those people that started the cholesterol myth. It's the same thing. You see cholesterol co-present with cardiovascular disease, and you already have a drug to treat high cholesterol. You say, oh, cholesterol is the evil guy. Let's lower it, right? And treat heart disease by doing that. Same thing here. You see dihydrotestosterone rising in the scalp of people that losing hair, and you say, oh, that's the evil guy. We already have a castration drug for prostate cancer. Let's use it for baldness as well. So to me, it's pretty clear that if nothing else, the theory behind hair loss that the mainstream medicine is pushing is false. I don't know if DHT will actually help you regrow hair, but the fact that estrogen antagonists work and DHT is one of the endogenous estrogen antagonists suggests to me that the rising levels in the scalp of balding people is that it's an adaptive change. It's there to offset the high levels of estrogen and the high expression of the estrogen receptor as well.
So just to complete this thought, two things. Everybody knows that anti-aromatase drugs cause hair loss. And then two, what would you say to, there's a few papers that talk about topical administration of estrogen regrowing hair.
So first of all, the aromatase inhibitors causing hair loss. I don't. If you look at the studies, you'll see that there is not a single aromatase inhibitor that is specific for aromatase. All of them actually end up also lowering progesterone, right? So, and actually, the study showed that it is the level of expression of the estrogen receptor in the scalp specifically that was responsible for hair loss. When they administer estrogen systemically, it did not have the hair loss effects that it had when they actually applied it topically. So the aromatase inhibitor that you're taking, may drop your estrogen systemically to the point where you are, it shows up on the blood test that you use of systemic estrogen. That doesn't mean much about your scalp. I mean, it's the whole dichotomy between blood levels versus tissue levels, and specifically in stressed tissues such as a scalp losing hair, right? So if your thyroid is low, we already talked about this before, your skin will pick up the slack and start producing all of these steroids. And basically, if you look at the scalp, there are a few studies that actually looked at the hormones in the scalp. Estrogen was and prolactin were also high. For whatever reason, yes, DHT was also high, but somehow the medical industry took that partial finding and started running with it while completely ignoring the fact that other hormones, estrogenic hormones, were also high. So again, nobody so far has proven conclusively, causatively, that DHT causes hair loss. I mean, I know people who have actually massaged Masterone, DHT, Provolone, and a bunch of other DHT-derived drugs on their scalp, and some of them actually started regrowing hair. It didn't work in many people. It was maybe about only 20%, but none of them lost more hair. So, I mean, it's called an anecdotal. It doesn't have statistical significance. But this thing, I mean, that would be my response to people saying everybody knows aromatase inhibitors cause hair loss. Show me a selective aromatase inhibitor that does nothing else except inhibiting aromatase, and let's see if it causes hair loss or not. To my knowledge, there is no such aromatase inhibitor on the market. And actually, we had this discussion a little bit on the forum because people are saying, "Oh, if estrogen is not important for the bones, how come when I take an aromatase inhibitor, I'm getting joint pains, like my bones are cracking, all these studies showing bones are thinning?" Again, you have not covered the fact that it lowers pregnenolone, lowers progesterone, lowers DHEA as well. These things, because the enzymes are the different enzymes, both the ones that synthesize estrogen from precursors and the other steroids that synthesize progesterone and DHA, they're very similar in structure. It is very hard to develop something that is so uniquely specific to aromatase without touching steroids, other steroidal enzymes and pathways. It, Ironically, progesterone may be one of the most selective antagonists out there. And to my knowledge, people taking progesterone who have managed to tank their estrogen on tests, they actually specifically use progesterone as an aromatase inhibitor. There were women that didn't care about like tanking their testosterone or whatever other reasons men are afraid of progesterone from, right? And then none of them got joint pain. None of them got cracking bones. None of them got osteopenia. In fact, their bone health improved. So all of these side effects that people blame on the too low estrogen from aromatase inhibitors, to me, the evidence for that is lacking. I mean, if anything, we can say that non-selective aromatase inhibitors cause issues, but to blame it completely on the lack of estrogen, I don't think there's evidence for that. So, and what was the other one you said? Like basically, oh, people getting treated with estrogen. I looked at those studies. Most of them are about people doing transgender, basically switching genders. And I think in the vast majority of cases, these people got a combination treatment of a progestin and estrogen. The reason this is the vast majority of cases, if not all of them, at least the recent ones, is that the changing gender wasn't very popular in the 20th century, all the way up until, let's say, like early 90s. And at that point, medicine had already realized that giving people only estrogen is very, very dangerous. So you'll be hard pressed to find transgender studies that used only estrogen. If you find one and show me that this led to hair regrowth, I'll consider it. But so far, the studies that I've seen always had something else. Either the person got estrogen and testosterone, if it was like a female to male, or basically like the person who got their who was converting from male to female, they actually got castrated. Keep in mind that actually drops estrogen, right? So the
And
studies that I've
serotonin
seen,
and prolactin.
that's right. That's right. So the studies that I've seen have not been able to isolate the estrogen as a cause of hair regrowth, and I don't believe it is. I don't know of a study that actually is well designed and has managed to isolate it to claim a cause. If you have such a study, please send it to me because I've looked at this, and almost all of them are progestin and estrogen, or male to female, and they got castrated. So things like that.
I know I'm recovering old ground here, but I'll probably cut this out, and so I just want to complete the thought. But I think there's one study where they might have used some kind of topical treatment of estrogen, and the guy regrew hair. And so I'm curious on your thoughts. But since minoxidil is a pro nitric oxide drug or agonist or whatever, and finasteride by decreasing DHT. I don't know if it's ever been measured, but probably I think DHT is like a nitric oxide inhibitor. Do you think it's
Yeah.
plausible that putting yourself in this intense stress state where you're increasing estrogen to and nitric oxide to a supraphysiological level increases vasodilation, and then that can result in some type of head hair growth?
I think the mechanism in my view is related to local tissue injury. Ray mentioned a few times that people like fell into a fireplace and burned his scalp, and then he started regrowing hair. And
Mm-hmm.
another one got like a cut across his scalp with a knife,
Mm-hmm.
or some kind of a sharp tool. He was working in the garden, and then he also regrew hair along the scar, like around the scar. So minoxidil and I think works along the same lines. I'm not sure if it's the nitric oxide because people have actually tried applying Viagra because they looked at minoxidil and said, oh, so maybe it's the nitric oxide that works. So they actually tried applying Viagra to the scalp. It did
Mm-hmm.
not work.
Mm-hmm.
I mean, to me at least, the true mechanism of minoxidil is unknown. The same way the true mechanism of finasteride damaging everything is not completely known. I mean, at this point, there's evidence that finasteride is actually an androgen receptor antagonist, similar to flutamide.
Mm-hmm.
So it's been sold as 5-alpha reductase inhibitor, and it surely is, but it's also been shown to disintegrate the androgen receptor in the cell,
Mm-hmm.
very similar to androgen antagonist drugs. It's also known to raise prolactin. It's known to also bind to the estrogen receptor and potentially activate some tissues. Nature, and that should actually be a sign for all of us that yet another reason why Ray's ideas strike more true, because he talks about systemic effects and the virtual impossibility of isolating an effect down a specific receptor or a specific pathway. And if all these drugs work, either pro-stress or anti-stress, that's how they should be viewed, and not necessarily through their receptors. So, and by the way, the minoxidil, it's been shown that after about 6 months of usage, you're reaching a plateau. And if you continue using at the same frequency, after it, you actually start losing hair. So whatever minoxidil does, it's temporary, and it does, which corroborates the idea of like an initial shock reaction on the scalp, and somehow triggering, like you said, blood flow or some other kind of like a regenerative mechanism. But it clearly over time, minoxidil starts to inhibit its own beneficial effects, which tells me that it's probably not a good drug. I mean, whatever it does, it's similar to menopausal women with hot flashes and really severe PMS symptoms. When they get a little estrogen initially, they feel relief, but if they continue taking it, they very quickly go berserk. I think the same thing applies to the minoxidil treatment.
Well, the nitric, I just wanted to dwell on this for a second. It wasn't obviously hypertension is something that's been studied in relation to pattern baldness. And then minoxidil, I think, was originally being used as an anti-hypertensive drug. And then isn't it commonly thought of as hypertension is a deficiency of nitric oxide, and therefore they give these pro-nitric
Yeah.
oxide drugs? But of course,
Yep.
and maybe our view, we would look at that as low thyroid and a lack of carbon dioxide. So I mean, I just want to
Right.
grapple with the fact that, and maybe you talked about it and I missed it, but like finasteride does regrow hair, but we were just talking about how many negative effects it does. Like, I mean, it occasionally does that in a small percentage of people, and the only reason people are probably watching this or interested in the content on my channel is because these main things we've been hearing about for many years don't really work that well.
So I have to find it. There was a study about finasteride showing that it does work as an estrogen receptor antagonist, but they tested different cells from different tissues, and it didn't act. It was basically like a serum, right? So the finasteride regrows hair, and I think it corroborates the study that I just posted. It does have partially anti-estrogenic effects depending on where it's
Hmm.
applied. But if your tissues have a very high expression of androgen receptor, it's the anti-androgenic effect you're going to feel the most, right? So this means things like prostate, gonads, brain, let's say like liver, spleen, thymus. All of these express the androgen receptor very highly. So the effect, this in these tissues, finasteride will primarily quote unquote shine. I mean, it's not a good effect, of course. It's going to shine as as an androgen blocker. And in other tissues, such as potentially your scalp, maybe over there it's proprogesterone, it's and a slight anti-estrogenic effects that works. I'll find the study, but I'll send it to you. It did show that in some tissues, finasteride does have anti-estrogenic effects. So that may be why it regrows hair.